text reads, ATSDR's Petition Program. Make your voice heard and protect your community's health. The ATSDR logo appears. Next to the logo, text reads, U.S. Department of Health and Human Services, Agency for Toxic Substances and Disease Registry.
Our environment is where we live, work, and play. Sometimes substances get into the water, soil, or air in our environment, and that can lead to health concerns.
4 houses are lined up in a row. Wavy lines representing air move over the houses.
For example, if harmful substances get into your private well water supply, your tap water may not be safe to drink.
A yellow stick figure representing a community member stands by a kitchen sink about to drink a glass of water.
Or imagine there's an industrial facility in your city that releases dangerous substances into the air. Breathing in those substances could lead to health problems for people in your community.
The yellow stick figure is now standing between a house and an industrial facility building. Smoke rises from a chimney at the industrial facility.
If you're concerned about an environmental issue in your community, you can ask a government agency called the Agency for Toxic Substances and Disease Registry, or ATSDR, to look into the issue.
A thought bubble appears above the yellow stick figure. Inside the thought bubble, the ATSDR logo appears.
ATSDR is a federal public health agency that works to protect communities from environmental health hazards like substances in the environment that may be harmful to our health. ATSDR responds to environmental health emergencies, works with state, local, and territorial public health agencies, and investigates environmental issues to learn how they may affect people's health.
3 icons appear above the yellow stick figure: a factory, a pipe emptying liquid into water, and a smokestack with smoke above it. These represent how harmful substances can get into the environment.
Through ATSDR's Petition Program, any person or community organization can ask ATSDR to investigate an environmental health concern in their community by submitting a petition.
The scene changes, and the yellow stick figure is sitting at a desk and typing on a computer.
A petition is a written request explaining the issue you're concerned about. You don't need to ask anyone to sign your petition, and you can send it directly to ATSDR.
2 other yellow stick figures join the first stick figure next to the computer.
To submit a petition, visit atsdr.cdc.gov/petition-process.html or send an email to atsdrpetitions@cdc.gov.
We zoom in to look at the computer screen. Text at the top of the computer screen reads, Submit a petition. The ATSDR website and email address for the petition program appear below.
When you submit a petition, ATSDR will carefully review your request and decide on next steps.
Above the computer screen, a yellow envelope appears, representing a petition to ATSDR.
As part of this process, ATSDR will review existing data or information that other public health or environmental agencies have already collected about your concern. ATSDR will also determine if the agency has previously conducted work at the site and check to see if people have made complaints to other environmental and public health agencies.
3 blue stick figures representing ATSDR staff are shown sitting around a table. The yellow envelope representing the petition is in the middle of the table. The blue stick figures are discussing the petition. One by one, the 3 stick figures each give a thumbs up.
The petition evaluation process usually takes about 6 to 12 months. At the end of the process, ATSDR will let you know if your petition is accepted or denied.
The yellow stick figure is back, holding a smartphone showing the ATSDR logo.
If ATSDR accepts your petition, that means ATSDR will start public health assessment activities to learn more about the issue.
Then, the phone screen is shown up close. The screen shows an email with a subject line that reads, your petition to ATSDR. The email text says, your petition has been accepted. There's a check mark below the text.
If ATSDR denies your petition, that means ATSDR will not be doing public health assessment activities on the issue, but they may be able to help your community in other ways, depending on the situation.
The phone screen changes. Now the email text says, your petition has been denied. There's an X below the text.
If your petition is denied, ATSDR will tell you why. For example, a petition may be denied if ATSDR has already addressed the issue. ATSDR does not have enough information to address the issue, or ATSDR determines that community members are unlikely to come into contact with harmful substances at levels of concern.
3 icons appear on the screen: a clipboard with a check mark in the middle of it, a thought bubble with a question mark, and a hand reaching toward a water faucet that's dripping water. The icons represent the reasons why ATSDR might deny a petition.
If your petition is accepted, ATSDR scientists will study the environmental health issue that you described in your petition. More specifically, scientists will work to find out if there are harmful substances in the water, soil, or air, if those substances could get into your body, and if they affect your health.
2 blue stick figures representing ATSDR scientists are working in a lab. One figure is using a microscope and the other is doing tests on a liquid in a laboratory flask.
ATSDR may work with your state and local health departments, territorial and tribal health departments, and community organizations to address concerns.
One of the blue stick figures talks to a yellow stick figure with a badge that represents staff from health departments or community organizations that ATSDR may work with. They shake hands.
Keep in mind, ATSDR is not a regulatory agency. That means ATSDR can't clean up harmful substances or direct facilities to change how they operate.
A factory with smoke coming out of a chimney is next to 2 houses.
It's also important to understand that ATSDR can't diagnose health conditions or tell you why people in your community have health issues.
A yellow stick figure that represents a community member is in a doctor's office talking to a doctor stick figure wearing a stethoscope.
What ATSDR can do is recommend steps that community members, organizations, and agencies can take to address possible health risks and protect the health of everyone in your community.
A blue stick figure, representing ATSDR, is speaking to 2 yellow stick figures that represent community members or organizations. One of the yellow stick figures is holding a clipboard.
To learn more about ATSDR's petition program and how to submit a petition, visit atsdr.cdc.gov/petition-process.html.
A computer screen shows the web page for ATSDR's petition program.
If you have any questions, you can call ATSDR toll-free at 1-800-232-4636 or TTY 888-232-6348. Ask to be connected to your ATSDR regional office. By submitting a petition, you can speak up for the health of your community.
The computer screen shows the phone numbers for ATSDR. Text below the phone numbers reads, "Ask for your ATSDR regional office." The ATSDR logo appears. Next to the logo, text reads, U.S. Department of Health and Human Services, Agency for Toxic Substances and Disease Registry.